8 million people will die this year from bacterial infection.
It really isn't a silent pandemic. It's very loud and it's very present in oncology wards all around the world.
Tackling antimicrobial resistance is a top priority for the Novo Nordisk Foundation. And as we could see from this event tonight, it is a multifaceted challenge that we face.
This is going to be an issue that increases, particularly in fragile settings. So as of now, we have about 2 billion people around the world. That's a quarter of the world's population in over 60 countries that live in fragility. The vast majority that are most impacted by health outcomes in those communities are women and children and the elderly. You can see where the correlations are with AMR, and with over 90% of AMR-related deaths occurring in those same regions and those same countries.
I attended a conference earlier today, and I've attended many conferences. What always comes up is, where is the patient voice? Where is the patient voice? We have a lack of patient voices compared to the other communities.
And I feel as if we haven't taken on the lessons from, again, other communicable diseases that we've needed to eliminate or eradicate. If we take the polio example, it's very clear. When we took that shift away from speaking about polio and acute flaccid paralysis and environmental surveillance and enterovirus surveillance, and we shifted to polio, it's a crippling disease.
It's happening a lot more frequently. So 1 in 5 cancer patients now is being hospitalized with a resistant infection. So we are very worried.
We need to act, we need to invest, we need collective efforts, and we need to act. And that is the Danish approach.
I think of this problem as a test for civilization, right? Can we work together and actually solve a problem that affects all of us? And if, in fact, shows the quality of our civilization because it affects the most vulnerable the most. We need to pay for antibiotics based on their value to society, not on the volume sold.
It is about those frontline healthcare workers. It is about the supply chain. It really is about the agricultural development, and it's about that at that point of care in those centers.
No single organization or country can tackle this alone. This requires global efforts from both public and private players.